Now, looking back at the first wave of the pandemic last spring, could we have done things differently to prevent the second wave that we're seeing right now?
Well, I think there's been a lot of analysis now of how prepared we were as a country for just such an event as this. For instance, there has been focus on the Public Health Agency of Canada. A lot of the internal structure of the agency meant that a lot of the built up expertise had been lost over the years. Clearly, the supply of personal protective equipment, PPE, that was supposed to be in place by the Public Health Agency was not in place. So a lot of these things have caused some consternation. So I think it's safe to say that we were caught as flat-footed as many other countries were. And that's ultimately the case, that it wasn't just Canada. The whole world was caught flat-footed, including the World Health Organization.
Now, in terms of transparency, which is so important to Canadians right now, has the federal government been open enough with Canadians during all that transpired in 2020?
Well, certainly we've done better than the People's Republic of China. Of course, a lot of the transmission of the virus, which started in Wuhan, was not known by the world until it was far too late. Then the federal government here in Canada was playing catch up. The initial advice to Canadians was don't panic. This is low risk for Canada and Canadians. And then they had to flip that on its head very quickly as the virus started to spread. So I think basically we were playing catch up all year as a country. But like other countries, we were doing so. It wasn't just us.
Now, you were Health Minister of Ontario during the SARS outbreak in 2002, as well as Minister of Health between 2006 and 2008. Were there any lessons that the government learned from the SARS outbreak implemented in this pandemic?
Well, as you can imagine, after SARS, there was a lot of navel gazing to see what could be done better. And some things were put in place that I think stood us in good stead. For instance, making sure that hospitals had negative pressure rooms so that the disease or the virus couldn't transmit through the hospital HVAC system, as an example. But also there were, at the time, recommendations that we should look at our long-term care homes, make sure that people didn't have 2 or 3 or 4 jobs bouncing around to different LTC facilities because they were only hired on as part-time. And that was identified as a potential way that a virus could be transmitted. And sure enough, that happened again with COVID-19, unfortunately. So some lessons were learned, other lessons were ignored.
And now we're battling through the second wave of the virus, and we're seeing new variants of this virus pop up. How can the government increase the confidence of Canadians as we start the new year?
Well, I think the important thing is everybody's looking to the vaccine. Let's face it. The vaccine is not going to be a cure-all. You can still transmit, according to the latest studies, still transmit the virus even while being vaccinated, but the impacts on you or anyone else being vaccinated are a lot less. So I think a lot of the eggs are in the basket of the vaccine right now. Meanwhile, a lot more is being learned about the virus, how it's transmitted and how it can be protected against. So hopefully 2021 will be a year not virus-free. I don't think anyone is suggesting we're going to be rid of this virus anytime soon, but at least better prepared and, as you said at the outset, hopefully returning to some aspects of normalcy in our society.